The most common test that we see for infant stool is a fecal blood test. So oftentimes this is called an occult blood test, OCCULT, occult. And what that means is it's microscopic. You can't typically see it with the eye. So the difference being like an occult blood, meaning it's there, but we can't see it, versus frank blood, which is blood that you can see. Like, oh, yep, I see that. There's definitely blood in this stool. And so that test, there are two main ways that we can produce that test. Well, three technically. One is that we can use what's called a lateral flow test. So that's like an at-home pregnancy test. And you can get these over the counter. We have them on our Amazon shop. It's basically a yes or no question, or yes or no answer as to like, is there enough blood to be over this threshold where the test can tell? That's often what you'll see used in your pediatric offices as well. If you take your diaper in and say, hey, can you test this for blood? Oftentimes they'll have a simple like few minute test that's a lateral flow, just like an at-home pregnancy test. The second type is called an ELISA, where they would take your stool sample, send it to a lab, and that lab would test it for hemoglobin or other inflammation markers, and you get an actual number, and something over a certain number would be considered a positive response. And then the third can be actually using a microscope and staining. And so always helpful if you're getting that test done to ask, what type of test is being done. And so that's in a fecal occult blood test. The other tests are lactoferrin, calprotectin. You can do a fecal fat stain test. All of these tests, what they do is they simply tell you if there's inflammation in the gastrointestinal system. So by seeing things like calprotectin is something that tells you when there's inflammation. Fecal fat stain tells you that there's malabsorption because of inflammation. Lactoferrin, same type of situation. And so the good news is that these will tell you that there's inflammation in the GI tract. The bad news is it doesn't tell you why. It doesn't say like because soy is a trigger food or anything like that. So it can tell us that there's food reactivity occurring, but it can't tell us what it is to. And unfortunately, oftentimes parents will be told, yeah, your baby's stool was positive for blood or positive for lactoferrin or others. That means they're allergic to cow's milk protein. That isn't necessarily the case. It tells you that there is inflammation and cow's milk protein could be the cause, but it doesn't actually directly correlate those two things.